Welcome to The Third Opinion, presented by Full Circle Health. Join us each week as we delve into the world of integrative and functional medicine through discussions, interviews, lecture series, and more. Our experts have been on both sides of the Western medical system and understand the frustrations associated with getting real answers about all of the available treatment options. Well, we are here to give you the answers. We'll take the time to break down the latest holistic and integrative medical procedures, supplements, and discoveries to help you better understand your body on a molecular level. Please keep in mind, this podcast was created for educational purposes only and should never be used to take place of a medical diagnosis or treatment. As always, make sure to take the time to submit any questions or comments you may have about today's show so we can give you the answers you need. Now, let's get healthy. Hello, everybody, and welcome back to the Third Opinion podcast. My name is Dr. Adelena, and I have the luxury of interviewing my guest today, Dr. Joe Dodaro. Welcome, Joe. It's nice to have you here today.
Nice to be here.
Yes. Well, I wanted to share a little bit about Dr. Joe's background. So he is a chiropractic neurologist, a researcher, and author, deeply committed to helping people live more fulfilling lives through improved brain health. His passion lies in teaching individuals how to achieve neuroregeneration and healing. With over 4 decades of clinical experience, Dr. Dodaro has a profound understanding of the impact of the loss of cognitive function on individuals and their families. Dr. Dodaro earned his Bachelor of Arts from the State University of New York at Buffalo and his Doctor of Chiropractic degree from Palmer College of Chiropractic. He holds a diplomat status in chiropractic neurology. His commitment to evidence-based care led him to obtain a master's degree in clinical research. He is also the president and founder of ProNeuroLight, LLC, which is a medical technologies company. He is also a very sought-after cognitive neurotherapist and a brain fitness coach, and is considered a world-leading expert on transcranial photobiomodulation. So he's a prolific author and speaker. Dr. Dodaro has published numerous highly cited scientific papers and lectures worldwide. His most recent work is in his book, My Brain Matters, The Neurometabolic Solution, provides a how-to guide for enhancing your brain power. So as you can imagine it, today we're going to talk about the brain, and we're going to talk about the lights. And I also want to extend to all the listeners that Dr. Joe Dodaro is also my dad. So obviously our abilities and desires to learn, I stemmed it from somewhere, comes from Dr. Joe. But even when I try to share my journey to health and my journey to being a naturopathic doctor, my dad's a key component to that. But I always extend the fact that growing up, my dad was a chiropractor, right? We grew up in Italy for a majority of our lives, and my approach to healing was very different. Anytime I would complain of something, what would you always say, Dad? Put the lights on it. He'd give us an adjustment, and you put the lights on it. So I am also slightly biased when it comes to photobiomodulation because I have seen the positive impacts in my health. You know, I haven't had an antibiotic my whole childhood until I went off to college, and I didn't have my light pads and my chiropractor with me. So those were instances where I had to fall upon Western aspects. So I'm going to turn it over to you, Dr. Joe. What's going on? I'm really, really excited that you're here and that we get to talk about the brain and the lights.
Well, the thing that pops into thank you for that kind introduction. And one of the things that strikes me is that if you zoom out, our perspective, and I think you have it greater than most people, is a holistic approach. And the third opinion, that's very significant because, we used to say, you want a second opinion, but a third opinion, that's kind of like, that's not what you want. You know what I mean? In Italy, they used to say, you're a doctor, you're my ultima spiaggia, which means you're my last beach, which means if you can't help me, I'm going to jump into the water or jump off the bridge and die. And that's kind of the wrong sighted way of doing these things. So in a holistic approach, that's part of really what we do as clinicians is we educate people about what is holistic. And the concept is difficult because most of them didn't grow up in a holistic perspective. And so I try to tell them, one of the things when I do with my clients is it's how much juice for the squeeze, meaning how much can you benefit from this intervention? And the problem is most people are looking at what do I do for the seed? What do I do for the pulp? What do I do for the skin? And if I do this, I'm focused on this, but I said that's not holistic, right? If you look at the orange theory, it's the entire mechanism. So you have to kind of look at the roots of the tree, how it grows and everything like that. So I think for the first introduction to, patients or clients that are looking at, what is it that, we're going to talk about today? It's this perspective of holism that they're probably not hearing maybe for the first time, but, chiropractic's over 100 years old. And I was kind of brought into chiropractic because of the philosophy of holism, if you will. So let's just start there and say if this stuff sounds a little different or a little bit outside the box, it's because it is the box, It is the box. It's not like the small things. So.
Well, and I love that you said the holistic approach, because also obviously being a naturopath, that's foundational to our therapeutic order. Our philosophies as a naturopath as well is to look at the person as a whole. And, you said how much juice for the squeeze. What I like to say is the biggest bang for your buck, because a lot of times, especially in the functional realm, a lot of functional doctors can get bad reps. Unfortunately, they're still here giving a pill for your ill, but instead they're giving you a supplement instead of a prescriptive, and that's supposed to be better. But a lot of patients aren't learning about their body. They're not able to really understand the strategies and the ways to heal and change a disease process as opposed to controlling it. So I definitely gravitate to what you say, and that's why when I'm looking at the biggest bang for a patient's buck, photobiomodulation, red light therapy as a standalone ties in so much. And I think even now, generationally, I think, the millennial, now Gen Z, all these different generations, red light's coming out there. Okay. I mean, we've seen it now for anti-aging. We've seen it for, weight loss. We've seen it for pain management. So I guess in the realm of photobiomodulation, I think I get asked a lot of questions now about it, which previously, how hard was it trying to break through this platform when you first came across red light and the benefits it offered?
Well, let's just break it down a little bit and back up and say, red light therapy is just one wavelength of light. And I know that low-level laser and low-level light and red light and everything like that, there's a lot of buzzwords out there. And, they're using it for beauty, right? But who wants to be the one in the memory clinic with the least amount of wrinkles, right? I think that we're moving in the wrong direction here. But, so let me just explain to you, like a lot of money and influencers, have gone into this red light therapy genre. And really what we're saying is they're selling you a panel of lights, like a big dashboard of red lights. And that is a therapy, but it is not photobiomodulation. Let's put it out there. Photobiomodulation, photo light, biocell modulation change. So it's light having the ability to change cellular activity. Okay. So it's just physics. If I have a panel a foot in front of me, it's not the same as having light, touching the skin. So I just want to say that most of the people that are buying these panels are kind of being marketed down the wrong path. What do I mean by that? I mean, I think we can safely argue just on basics of physics that a street light, on the road is not photobiomodulation. It's light therapy, but it's not photobiomodulation. So if I have a red pad or an infrared panel a foot from my body, the amount of photons and light energy that's actually going to hit you is very limited. But the point is, it's like the story of the guy that came in and said, "Doc, since you gave me that juice cleanse, I'm not an alcoholic anymore. And the point is, that's not really true. You're not an alcoholic anymore because you're not drinking alcohol, right? So the concept is, most of these people that are using a red light panel are turning off their LED lights in the house and using it that way. And that's a good thing, because you're reducing the garbage light or the toxic light and improving the good light. So on that sense of the circadian regularity thing,
seasonal affective disorder, those types of conditions, stuff like that.
It's very positive, but to say that it's going to raise your testosterone level because you have a pad out there, it's or my pain goes away. There's really not enough juice to make a change in the cellular level. I just hope I make that clear. Definitely. So one of the things that really, when we designed our pads, and we've been doing this for almost 20 years or so now, is we designed them based on science. A pad, a light, ours are soft and flexible, and they have the ability to conform to the body and put anywhere on the body. So it's good for the body, it's good for the brain, it's good for the nose, it's good for wherever you can put it. But the closer it is to the tissue, the better. Yeah. And that's why we have we have maximum coverage. It's the softest, most economical. It's really just the right way to do it. So it could be me talking about this for the next 20 years, but that's just the reality of it.
Yeah, and a lot of people I see have like the handheld, like you expressed, the one that's directly, and even if you said just in the sense of physics, if it's not directly on, you're going to lose a lot of that action potential within. The light's going to scatter, right? And so you're not getting
that. It scatters, it reflects, it's distorted. So it's not, it's touching, and then there's actually pressure, So if you can press it in there, it kind of has the ability to not be reflected. And so like a lot of it is, most of the devices don't have full coverage, just as an example, I turn mine on. So, because this is very important. This is my ProNeuroLight helmet. I know it's very bright, but you can see that it's down to the base of the neck, across here, gets the jaw, the forehead. We have little ways to modify this with little bands and stuff like that.
With straps and keeping it held put. I have used the helmet and I have seen it being so successful with patients with mental emotional conditions like anxiety. I have worked with the autism ADHD community, and I'll have a patient present to me with just here recently, I had an 18-year-old. I started working with this patient when he was 14, and he would pace. He would nonstop move all the time. He was just all the time, just wouldn't. And the mom's like, I'm worried about him. He's old enough that he's sleeping in his room and he's not, so I'm not managing, but I don't necessarily think he is sleeping, all these things. And as kind of a Hail Mary, this is not mainstream medicine, you guys. It's not, they come work with me. I support their nutrition. I have evaluated a lot of their functional profiles. And I said, I have this therapy. It's called photobiomodulation. Is that something you'd be interested in? And, the mom's like, I'll try anything. So in my clinic, I applied the helmet. I did apply some additional red lights over the solar plexus and other areas that he was having some challenges. And to also maximize that, instantly, the child fell asleep and he woke up calm as you would never have guessed that this was a neuroatypical child, the way that he was maneuvering through the room. And it was that moment in that instance alone was enough for the mom to say, what is this? How can I get this? So, and when you see those firsthand, and so many, unfortunately, this is an alternative therapy in so many ways, but it shouldn't be. It should be integrated. It should be utilized with all of our cancer patients, all of our autism. We could go on and on about that. But can you speak to a little bit about why that mechanism occurred for that individual, especially with that neuroexcitability that he was presenting with?
Well, you touch on a topic that's so pertinent right now to, our company and, my office clinicians and stuff, because we're just finishing up our clinical research on a case series. So we had 42 families who purchased the device and filled out questionnaires. And these were neurodivergent autistic kids with autism, right? The average age was 11 and a half, basically, and mostly males. So it's very typical. And of the people, we had 50% of the people return the questionnaires. And then my research assistant was decided he wanted to get a master's degree in clinical research, just like Dr. Joe. And we were able to use that data set to help him finish his master's degree. So what we used is two very popular health outcome measures, which was the health home situation questionnaire, which looked at social difficulties and demand specific problems, and also the autism parenting stress index. So these are two, very good outcome measures. And we watched these kids over the majority of them went over to 6 months, And the things that we found were quite astounding. As a matter of fact, this week we're having meetings with, researchers all over the world about this research. And later this month, we'll be presenting at the Mass General Hospital at Harvard in their brain photobiomodulation clinic to express these results, because really nothing has ever come close to this. So if I could just spin this around and relate it back to what you're talking about. So if a child has sleep difficulties between 0 and 12 months, he has a much higher likelihood of having autistic characteristics at 24 months. Now, let's just pause for a second. What did most of the parents that come in with autistic children say? He was good up until 2, and then everything started to go down the drain. That's not really accurate, right? Because waking up, difficulty going to bed, short sleeps, crying during the night, all these scenarios are showing sleep difficulties of an infant. And think about it. The reason that a child cries is neurologic, really. And if a child has a fever, he's going to cry, right? But the point is, if you have neuroinflammation in your brain, that is why children cry. And this is why they have these difficulties. So let me just pause there for a second to see how this kind of ties in. If a child has sleep difficulties from 0 to 12 months, that is a double-edged sword, because the whole family suffers with a child crying, a child waking up, So the amount of parental stress is incredibly high. And it's only exacerbated by, sleep deficiency in the parents. So that has trouble with the bonding. That has trouble with, just the parents trying to cope. So does that help a child develop? No. So what we found was that we had incredible changes in their behavior, social intolerances, and demand-specific things like wash your hands, come to bed, do these things. So those things were incredible and, greater than anything that's been seen in the literature, first of all. The second thing that was very interesting was the parental stress went down like over 50%. This is on average. So nothing has been like 25%, 30% is the biggest change that they've ever seen with this scale. And they actually, as one point, there was actually a study done with the same amount of kids, 21 participants, who used a different photobiomodulation device, and their amount of changes was like 2 points.
Wow.
But we had like 50% change.
And so when those children are doing the photobiomodulation, it's, yes, the red light helmet is a key piece, but do you also implement other pieces of red light and elsewhere, and where?
Well, let me point this out a couple different things. What we're saying is on 2 different levels. We said, Jesus, if we just had really checked the sleep, because we were talking to these parents, and first of all, the thing that got me was they said the children started to sleep like within the first week.
Yeah.
And the second thing is, when I'm listening to these parents talk to me, they're basically telling me that their children don't have autism anymore. Basically, I'm like, do they? And when I'm looking at these numbers, and then the statistician at the University of Arizona kind of showed this, I was like, these numbers are going down quite a bit. So the first thing is, in the questionnaires, there was a little point that said, difficulty with sleep. And so we looked at that. So I just wanted to point out that these children were severe autistic kids with high stress levels. I mean, these weren't like good kids. They were like the worst that these studies have shown. Now, we found that 60% of the parents reported that their children had sleep difficulties. And I'm like, Too much sleeping is not good either, but sleep problems. At the end of the study, virtually none of them had any sleep problems. So let me just kind of tie this together. In one of the studies, the Greek translation of the Autism Parenting Stress Index found that normal, typical developmental children had a score that was 12.
Lower than.
So 12. And when we looked at our feedback at the end of the study, the children on average had a parenting stress index of 12 or below. So essentially, they were like a normal kid.
They're having the typical challenges with sleep and such. And I mean, I
Yeah,
think
just everything as far as parenting stress. How's my kid going to grow up? I mean, is it this? It's like 20 questions, so it's pretty cool. So that's the one part. So that's the one thing. So the other thing that you stated was we implemented. So that helmet that I showed you has the highest output power of any device that's for sale, basically. And it's the most economical and it's the most comfortable. And you can wear it laying down, which is important because we told the parents. So this is how we work. We're a very caregiver-centric company. And what we said was, first of all,
wearing it. You told the parents,
try to wear it as much as possible because you're not sleeping, you're depressed, you have brain fog because, this is just what it's like to be a caregiver. And, maybe some of them did it. We forced them as much as possible. We didn't have all these notes. But we had them do the lights in the morning for 20 minutes. They applied it on the stomach and on the head. And then in the evening, before they went to bed, they put it on at night on the chest and on the stomach. So what I'm trying to tell you is this is the most powerful helmet, the most powerful device given twice a day at 2 locations. So the amount of light going into these babies, and we have some as young as 5 months, was incredibly high. And just like when we started to do transcranial photobiomodulation back 2017, when I built the first one, we were freaked out that this was too much light because our device that we built was like 100 times stronger than anything that was on the market. And we were afraid, what happens if we put this on these old people with Alzheimer's disease? What's going to happen? So think about it. These are children. Sometimes their fontanelles, their skull is not even developed yet. I was like, I don't know. But the mother said, I want the high-powered device and I want to use it. And away we go. So it just shows you that more is better. There was no side effects noted, no adverse effects. And this is true throughout the literature because there's a growing body of literature on this. So I just want to talk about the gut
medicine too, but I know what you're going to just jump into, and I have a couple points I want to note. But yes, the gut brain, the fact that we're utilizing the light pad over that solar plexus, over that where that vagal tone, vagus nerve kind of reaches that digestive tract, and we'll talk on that in a moment. But what's so interesting about even my approach when I work with patients is they complete a very in-depth health history form. It's probably a 13-page intake. And it goes all the way back to what their mom's pregnancy with them was like, where they grew up, what vaccines they had, illnesses, because I do know that obviously there's so much jargon now with adverse vaccine reactions, factors like that. And that's, and I think you made a nice way of stating that. You're like, it's not the trigger, right? It irritated something that was already happening, right? And it ties into what I believe in is generational health. I mean, imagine if the mom that's pregnant is using red light and in applying it, and then and that's being as a resource throughout her journey into that, et cetera. But you're going to speak to that.
I'm going to just point out. I just want to point out that let's say, and I don't want to talk about this. These are big studies that we're referring to with these sleep problems. Okay, so just hold on to that. This is actual. This is tens of thousands of children in 2 different continents when they studied this. Okay, so sleep problem is the trigger. Yeah, that's the first thing. And the second thing is we didn't get to produce this research or present this research. But let's say I'm a mother and my first child is neurodivergent, and I want to have another child. That's an added stress. You can see that. But the same Chinese guy that did some of the original autistic rat studies, right? So they give him valproic acid, which kills the neurons and gives you autism in the rat. Well, he put the light on the pregnant rat, then gave him valproic acid, and the little rats didn't have autism. So I don't want to.
And that ties into all of the foundations of what I see when I'm working even through functional genomics, and I'm looking at some of the areas that maybe they have some predispositions when it comes to methylation, detoxification, when it comes to inflammation, all those things. I mean, it ties in so well. And obviously, one of the things that my dad has told me since I was young is like, and I told him, hey, I want to be a doctor and all these things. He's like, your practice is always a reflection of what is happening in your life. And obviously being a mother of young children and being so well informed about these holistic strategies, you tend to see more things. I'm more aware of that now, Dad, when we would sit around and he would tell me all these things about individuals around us. But you start to realize, like, why would you not, if the research is out there and it's promoting, and maybe you don't have a neurodivergent kid, maybe you're blessed, right? But why wouldn't you apply red light or photobiomodulation to support and sustain their health status or revert any conditions, before it starts to happen, right? So yes, obviously working on mom's health and such, but even when we're talking about photobiomodulation, I have seen it, in my own household. And what's so beautiful about kids, especially in that is that there is no placebo. It's like it either, they don't necessarily recognize it. So it's amazing to work with that population type because it either works or it doesn't, but they are so in tune. Like my kids ask for the red lights. Like they ask for it. They say, I need the lights on. My tummy hurts, and obviously I'm like, of course, and I'm always like, are they just doing it because they see us do it? Are they, even if that's the case, I think that should be, more so mainstream, I guess.
Well, let's peel that back for a second. Remember that, bonding is about skin on skin contact, right? And the energy that you give off is infrared light. So basically, if you, like I said, they used to tell me, what's the best adjustment that you can give somebody as your 40 years of experience? And I said, a hug. So the point is that having the infrared light touching the body is very important, and these children like that. So that could in itself can be a sleep aid, right? That nurturing
the oxytocin
things like,
that gets potentially excreted
for both of them. So let's just circle onto the sleep section for a second. So one of the things that because we have full coverage of the head and the chest and the body and everything like that. So we could talk about how the gut microbiome changes with light. That's very cool. That's like a new, very, very in-depth study. And we have, studies going on that, but there's enough research on Parkinson's people, and they come out with Downs, and there's a new study coming out from Texas on this, on what putting photobiomodulation, red and infrared light, on the gut itself and what it does to that microbiome. It's called GM photobiomodulation, gut microbiome, or photobiomics.
I like that.
So it's very, very cool. Yep.
Kind of like a biotic, probiotic,
Well, photobiomics. So what it basically does is it putting the light on the belly increases the good bacteria and decreases the bad bacteria. And the downstream effect of that is that the life-giving substances get to the brain. Yeah. And that's really important. Again, you touched on a good point, the vagal tone and the vagal stimulation, but increasing blood supply. Let's just think of it this way. You increase blood supply, you increase energy, and it's an ecosystem in your gut, and everybody's fighting for territory, and they have some good mechanisms on how this works for good gut health. So let's just break it down for a second. If I have, so think about this for a second. A child is born. They don't have a gut microbiome. They get some from the mouth through the vaginal birth. They get some from the skin of suckling on the mother's breasts, and they get it from the breast milk. So how can I have a neurodivergent child with a gut microbiome problem from where? A 2-month-old, when they don't eat any food. So let me spin this back to you and tell you this is what happens, in my opinion. And this is what the data shows. If I have neuroinflammation from birth trauma or any kind of trauma or anything like that, vaccinations, things like that, I'm going to have neuroinflammation. And that toxins in the brain doesn't do good. And that toxin has to be removed, and it goes into the gut. And that toxin kills the microbiome. So it's a brain-gut connection. And why do I say this? Because if I have a sleep problem, and children, infants, they sleep 17 hours a day, followed by like looking around and like this, and then back to sleep. And this is very critical for their neurodevelopment because they are burning chemicals and toxins are in the head and they have to be removed. If I'm not sleeping, or if for some reason my glymphatic system is compromised, that toxins stay in the brain and it influences the way that the child will develop poorly. Neurons are stripped away, synapses aren't made, progenitor cells don't come in because there's not enough fluid. So we've found that from the literature that there is glymphatic dysfunction in autistic kids. Mm-hmm. So it means that their brain's cleaning system, waste removal system is not working. That means more toxins, that means more neuroinflammation, and that means you're not going to be given the chance to express your humanism if your brain is full of toxins.
Well, and if you look at, yes, the glymphatic system is honestly one of the most, or I should say, less researched or understood at this point, because even in the naturopathic viewpoint, we always talk about the emunctories, the pathways of excretion. So your liver, your kidneys, your lungs, your skin, your lymphatic system, your digestive tract. And so obviously when one area is compromised, the rest of your body has to shift in order to compensate. So if you think of it this way, those individuals, when I go through my health intake and they say, oh, I was a C-section baby, I was not breastfed, already I'm looking at nuances of neuroinflammation by the aspect of their gut microbiome didn't have a lively chance to grow. And then they're seeing vaccines. So they're basically, you're adding these exogenous or outside forces. So detox and the glymphatic system is now, I would say, more understood. It's getting out there, but through our way. But I want to say two things about the functional testing approaches to what you've expressed and shared. So I do a lot of functional stool testing with my patients, and that's an opportunity for me to see what their microbiome is looking like. What are your good guys? And you had made a mention about, they're all fighting for life there. And so many of my patients have this misinterpretation of what the word dysbiosis means. They think dysbiosis is solely the bacteria being present. But did you know that there can be dysbiosis when there's an imbalance in your own good and bad flora? So even in our beneficial flora, we have Bifidobacterium, Lactobacillus. Those are the main strains. Those are kind of our first, I call them the first responders. They're like the main military, the army. But we also, in our beneficial strains, have Bacteroides, Clostridium, E. coli, Enterobacter, or Enterococcus. So we have all these, spore-based that if not left checked basically by your lactobacillus and bifidobacterium, you're setting yourself up for friendly fire. They start to say, hey, I don't have to listen to you. And that can be a trigger for a dysbiosis or an imbalance in the gut flora, because if you don't have enough of the bifidobacterium, you're not making enough butyrate, which is obviously protecting your colon from colorectal cancer, but truly has that gut-brain axis effect. Lactobacillus helps with yeast and pH balance and a lot of other beneficial things, especially for us as women. So what I want to say is that red light, you've expressed the benefits that it offers. Imagine combining photobiomodulation with functional testing and appropriate supplementation to fuel those efforts. And so I just hope that people are seeing that it's not where do I go? It's what's the perfect sauce? What's the perfect recipe for you to get the biggest bang for your buck, the best juice from that fruit, right?
Well, I think that you have to have a multimodal approach because it is a human, and the human is full of systems. So a systems approach means, just stop and think this way. The educator of chiropractic, B.J. Palmer, said, I'm no bumbling medical doctor. Let's try this, and let's try this, and let's try this. I figured out this is the cause, this is the cure, let's move. And that's basically what people pay for, is the cure. They want to see the results at the end. And I think that's why a multi-tiered and a holistic approach is not going to throw one thing out of balance. And I just to repeat, My Brain Matters is like a how-to book on how to do this thing. I know we're on a high level here. We're
Yeah.
talking on a high level here, but the scenario is, it's it's thoughts, toxins, and trauma. So, if you're going around, making your thinking bad thoughts all the time, that's not cool. If you've had a trauma and of any kind, it's going to affect, tissues and brain especially, and
Your
then toxins.
physiology.
And we're in a toxic world, so we have to fight this every day. But I also want to point out that, the blood-brain barrier and the gut barrier, those tighten up when you put the light on them. So
Mm.
it's a multi-prong approach because, we are humans, and we didn't have clothes on when we were developed. Sun hit us all the time. Is that photobiomodulation? No, but it's good for you.
Yeah.
So things let's do more good things. Help with the sauna, things like that for the detox.
And that's
I think.
my question
Go
too,
ahead.
though, Doc, is that infrared light sauna with photobiomodulation or red lights in there, how would that relate? Obviously, the high temperature
Well,
influences cellular metabolism and such. So would that be as beneficial than placing the pad, or can you mix them
let's
together?
put it this way. The topic that you brought up is, I just want to say that for anybody who's considering a clinician, that this Dr. Adelena Isold has a wealth of perspectives to pull from. Now, I'm a chiropractor. I studied Native American culture, so I understood a little bit about the native or ancient healing practices, et cetera, through my thing. But, and then the chiropractic philosophy of holism and everything like that. But Adelena's got a lot more, books that she read. So, but one of the things is that, you talked a lot about detox and stuff like that, and the liver and the gut, and that's very important. But if you back up a little bit, I had Perry Nicholson on the podcast, and I said to him, Perry, does the lymphatic system of the body, is it there to, what's it there for?
Yeah.
And basically the answer is the lymphatic system of the body is to keep the brain healthy, period. So
It helps move water, fluid, and immune system specifically.
all that.
Yeah.
All that. So the thing is, we got to kind of switch our thinking a little bit to the thinking part, which is the brain. The body does what the brain says, basically. That's kind of how it works.
That was like the foundation of everything. And I went to a brain health conference in Dallas, and it was so interesting. Like you said, the systems approach, everybody wants to focus on the thyroid and all these things. And it's like, yeah, but what's the source of all this? It's the brain, right? And so it was so beautiful to make those connections back. But sorry to cut you off, but you were saying.
As I say, but being a brain geek, I kind of consider myself, I'm the guy that studies the black box within the black box. So it's a little complicated, but they do pretty good at it, with the way that we therapeutically assist people. So the bottom line is, the 2026 is going to be about brain. And people are going to, because the technology and our ability to understand things are coming along, and the acceleration with the research, we're going to understand that the number, is not your cholesterol number. It's not your blood pressure number. It's your brain's readiness number. And that's kind of where we're going to be circling back to, because talking about a toxic world, we have the long COVID people, right? We have the new COVID people. And all these things create intense neuroinflammation that if we do not remove it, we're already looking at what was this, 5 years ago, 10 years ago, they were saying about how much Alzheimer's is going to be around, it's going to be like a tsunami of these things. And I looking back at my talks from 7-8 years ago, and I was like, Dr. Joe already said that. But the point is, it's only accelerated when you add these toxic environments,
and our body's not meant to, that's obviously the foundations of naturopathic medicine, right? Get back to nature, get back to, all these things are great ideas, and we're not discrediting, but a lot of those ideas are then pushed through with propaganda, with, the financial aspects. I mean, we can go down those rabbit holes forever. But one thing I wanted to touch on in terms of other functional guides, are you familiar with the Dutch testing? It's a dried urine testing analysis that looks at hormone metabolism and excretion. But one of the sections in that profile looks at neuroinflammation, and it literally gives us a gauge of how much neuroinflammation is present in this person. It looks at methylation. It looks at your melatonin production. So, literally, what is your cortisol, which is your stress hormone throughout the day, and how is your body actively converting that to cortisone, which is our natural anti inflammatory? And we can ultimately see if somebody is more sympathetic overdrive, hey, this is cortisol driven issue, or are you just overtly inflamed and your body's not getting that deep restorative sleep in order to actually break through to
Correct.
healing. We're ultimately just
Correct.
keeping you status quo, which, for a lot of people, that's great. I'm not sick, but you're not necessarily healthy either because you're not changing that. So, that is a beautiful functional test that if you have any patients that are looking for more objective gauges for their neuroinflammation, that is a
Mm,
wonderful test to explore. It looks at dopamine, different norepinephrine, epinephrine. So it's a very, very
like that.
specific and hormone metabolisms. It looks at methylation, the COMT. So I mean, it's very, very in depth.
We have a new app that I would offer to your people if they reach out to you.
Yeah.
A new app that really will show you the level of neuroinflammation basically on your phone. So it's a cognitive test that shows you basically how restorative your sleep was, how good your sleep was. I put that at the show. It's not ready for prime time yet, but for select people, we will put that out there because it is a measure of your glymphatic function. It is a matter of your ability to stay focused and to how good your brain is, how much horsepower you have.
Yeah, how much output and how, how clear are those pipes? And I really think, as much as yes, we focus on the brain, and I think it should be the ways that we're approaching health, those paradigms should be shifted and the brain health should come as a higher focus. I think that, even with some of our, like you had mentioned, traumas, obviously talk therapy is huge and it shouldn't never take the place of, but imagine how much that can amplify those efforts, right? Is, looking for connection and the red lights. But what I was getting at is also, yes, brain health is foundational, but as a holistic provider, it's also like, okay, what is contributing to that neuroinflammation? Yes, we want to offset the neuroinflammation to almost like tell the body, hey, we're okay, we're safe, we're healthy, we have access to sleep, we have access, we don't need to make all these, reactive compounds in retrospect, right? But I'm saying the look of the functional realm of looking at your gut ecology, looking at your microbiome, and then kind of piecing it together and saying, hey, if you're not making enough butyrate, if you have dysbiosis, if you have a lot of inflammation, let's say calprotectin, lactoferrin, all those things, well, then yeah, your brain is prioritizing that. It's basically saying, hey, we can't deal with anything else until this gets handled, and that's really the body can only handle so much. And that's really what I try to talk about is that natural hierarchy that the body carries. It's like, we can't do it all. Okay.
Not
But
only that, not only that, but you remember the subtitle of the book has 3 subtitles, so I kind of messed that up. But the neurometabolic solution is really what we're talking about. So the body will not reproduce, the body will not grow more cells, it will not put out more energy if it's compromised energetically.
yeah.
So I 100% agree with you. And I think one of the things that, to tighten this up and to close this out is that we don't have the glymphatic department at the hospital. You know what I'm saying? There's
Yeah.
not a lot of people who understand and can go in and kind of have a holistic approach when it comes to the brain.
Yeah.
So these breakthroughs come from the, outside the box. So I just want to share that with you that as more health professionals, probably not going to catch up to what we're doing, but the book has 1,000 references and it's a good place to start. I mean, just to kind of gather your thoughts on how you should do this. But the scenario is, this is our experience of reality, somewhere, in the system, but at least between these two temples is where a lot of our humanism comes from. And the bottom line is, if you're not helping raise, healing consciousness for your client base, then really,
I got
really
goosebumps when you said that, healing consciousness, because that's really what it comes down to, is that awareness. And I think what better active mind body practice can you do with, it's functional medicine. It literally connects and validates so much of what patients experiences. Oh, did you know that this is causes this? And they'll go, that's exactly what I'm feeling. And it's so funny how, a lot of times I look like a detective, for so many patients. I always tell them the labs don't lie. Like, you can tell me I eat organic, I do all these things. And then I look at the labs, I'm like, no, you don't. And, so it's very clear to see a picture, a snapshot in time of what's happening in your body and how that's relating to your overall health. And I really am grateful for our time that we had together today. And I know this will be one of many. And I think that, in a lot of what our next sections can come is more so for pain management, neuropathy, like protocols and such, and how that can benefit for patients, the use of red light and some of our modalities like soft wave, functional testing and nutraceutical diet lifestyle modification. So if you guys are interested in anything that Dr. Joe had to share today, I would prompt you and tell you, hey, go check out My Brain Matters, which is a beautiful book. It's a little dense in the beginning, but it definitely lays down a lot of the literature and the research that validates this. I think a lot of us, I don't want people to go and learn about red light through their influencer on TikTok. Why don't you learn from somebody that developed it and is at, the forefront of this technology? So Dr. Joe would be a great resource there. And I know that you are joining us all the way from Costa Rica. That's why we heard all those beautiful birds in the background. So we're just very grateful for technology, for moments like this that we can connect and share our wisdom and our goofiness with our listeners. And if there's anything else you want to add, but if not, I'll close us out and say thank you again.
Thanks. I look forward to our brain body detox session that we're going to do later. Thanks for
Yes,
that.
and doing your Dutch testing and figuring out, and we can compare that to that other Eli type testing that they did to really see. We'll figure it out. But thank you so much. And for all of you listening, thank you.